At the bedside, again compare the medication label with the MAR. Discuss the purpose of each medication, its action, and possible adverse effects. Allow the patient to ask questions. Find out where the last injection was given by checking the MAR and/or asking the patient. Then determine which site you'll use. Shift the patient's bed linen to expose only the potential injection site and surrounding area. Inspect the area for bruising, inflammation, and edema. If the skin is bruised or shows signs of infection, use a different site. The best sites for subcutaneous injection include the outer aspect of the upper arm, the abdomen from below the costal margin to the iliac crest, and the anterior aspect of the thigh. These areas are easily accessible and large enough to allow multiple injections. Palpate the site and avoid any area that's tender or in which you feel a mass beneath the skin. To make sure you have the right size needle, use your thumb and forefinger to grasp a skin fold of tissue at the injection site. Measure the fold from top to bottom and check to ensure that the needle is about half as long. Give preference to abdominal injection sites when you're administering insulin or heparin. Specifically, the best subcutaneous site at which to administer low molecular weight heparin is at least 2 inches or 5 centimeters to the right or left of the umbilicus. If the abdominal area isn't available, look for a site on the thigh. For insulin, systematically rotate injection sites within one anatomical region, either the abdomen or thigh. Help the patient find a comfortable position and ask him to relax the area you're about to inject. Apply clean gloves. Clean the site with an antiseptic swab. Remember to begin at the center and move out in a 2-inch radius, cleaning in a circular pattern. Remove the needle cap or protective sheath on the syringe by pulling it straight off. Hold the syringe between the thumb and forefinger of your dominant hand as though you were holding a dart. If your patient is of average size, hold the skin across the site or pinch a fold of skin with your non-dominant hand. Insert the needle quickly and firmly at a 45 to 90-degree angle. Release the pinched skin. Rest your non-dominant hand on the patient and use it to stabilize the syringe. If you're using an injection pen or giving heparin, continue to pinch the skin during the injection. If your patient is obese, pinch the skin and inject the needle below the tissue fold at a 90-degree angle. Move your dominant hand to the end of the plunger and slowly inject the medication over several seconds. Retain your grasp on the syringe to keep it still. Quickly withdraw the needle. Place a swab or gauze pad on the site and apply gentle pressure. But don't massage the site. If you've just given heparin, hold the pad on the site for 30 to 60 seconds.